Well, for Americans aged 18 to 45, one of the leading cause of deaths is fentanyl overdoses. The addictive drug is responsible for nearly 70% of the United States drug overdose deaths since 2023. Now, 2024 saw a drop in the number of overdose deaths due to fentanyl, but how prevalent is this drug in the tri-state? Megan Phillips with River Valley Behavioral Health joins us now with that answer. So good morning, Megan.
Good morning.
I mean, we had the opioid crisis, which this still classifies as such, but fentanyl, when did this start coming about? Why did this become a thing?
So fentanyl has been pretty prevalent in the community for more than a few years now. So, unfortunately, as much as I would like to be able to say that we're seeing a decrease in fentanyl in our community, unfortunately, just a couple weeks ago, during an arrest that was made in Davis County, there was over 5,000 fentanyl pills seized. So, obviously it's still pretty prevalent in the community. We want to make sure that we're educating people about the risks that are associated with fentanyl use. So River Valley is, we're here to provide services. We offer a multitude of different services for substance use, as far as, education. One thing that we wanted to discuss was that this is not something that is specifically for one demographic. We're seeing this within the community from adults to young adolescents.
Wow, really? And what is really bad about this drug is it's just a super small grain of sand.
Very small, yes.
Can be deadly.
Yes.
And we had police officers who have actually touched it while they were investigating and searching a vehicle, and they had to use Narcan. How are people, I guess you will say, surviving this with it being so deadly? I mean, we know the overdose deaths are there, but is this just because someone has just built up a tolerance to this?
Yes, they definitely could, but I think also the education that's being provided on Narcan and it being in the community now and people being more educated on the uses of Narcan has also helped a whole lot too. So
where do we go from here? What is River Valley Behavioral Health doing to help people? Is it to help them get away from this drug, or just to prevent it getting on it, period, or both?
Both, most definitely both. Our biggest thing is educating, harm reduction. We want to make sure that people are aware of the risks. River Valley, we offer a multitude of services for substance use disorders. We focus on mind and body. So, we offer recovery housing. We also offer inpatient and outpatient therapy services, primary care services. We have intensive outpatient therapy. We have residential. So, we have a multitude of services. It just depends on, what that individual specifically needs.
And it sounds like that it is what you all are doing is being effective, because you did mention the numbers did decrease.
Correct.
Now, you're still waiting for 2024 numbers?
Correct.
Okay.
So 2022 to 2023, we did see a decrease in the overall overdose deaths in Kentucky. However, one thing to mention is that there was an increase in overdose deaths between the ages of 4 and younger.
Wow.
As well as the age of 55 to 74.
And with the 4 and younger, you said?
Yes.
Would that just be because of maybe neglect with parents or supervisors in the house?
Correct.
Wow, really?
Yeah.
So what kind of trend do you see here? Because we had the numbers going down, but then going up in a certain demographic. Any idea what's going on in that older age demographic as to why it would be going up there?
Maybe just lack of education. Okay. Lack of knowledge of, of how just risky fentanyl use can be. So that's primarily what I think is the reason for that there.
And so, I mean, you mentioned it is education to let people know, really. So how are you getting out in the community to let people know this drug is out there. You've got to be careful.
Yes. So River Valley, we will go into churches, we will go into factories, companies, schools, anywhere that we're asked to come to. We'll go there and we'll provide the training for Narcan as well as the education on fentanyl.
Okay. Well, Megan, thanks so much for your time this morning here. And tonight, I'm sure you know more about this, so there'll be an in-depth look at this emergency and some of the innovative strategies being used to tackle the deadly fentanyl crisis. So our special program, The Next Generation Breaking Fentanyl's Grip, will air tonight from 8 to 9 p.m. over on the CW7. And again, starting at 9 o'clock right here on ABC 25. That will be 2 days from now on March the 26th. Megan will be back with us in our 7 o'clock hour and 8 o'clock hour as well, as we look at focusing on more topics here about fentanyl's grip in our community. Ron's forecast for you is up next.